Have you ever received a bill for a virtual healthcare visit that seemed incorrect, or perhaps higher than you expected? It can feel incredibly frustrating and confusing to navigate these unexpected charges, especially after you have already completed your appointment. The good news is that you are not alone in this experience, and there is a clear process you can follow to address and resolve these billing discrepancies. The process to escalate a virtual care bill begins with understanding your options and systematically working through the channels available to you. Essentially, you will start by directly engaging with the healthcare provider's billing department, and if necessary, gradually move to higher levels of review, including your insurance company and potentially external regulators. This structured approach helps ensure your concerns are heard and properly investigated. Billing issues with virtual care often arise from several common factors, which is important to understand. Sometimes, it is simply a coding error, where the service provided was incorrectly entered into the system. Other times, it could be a misunderstanding of your insurance coverage, perhaps due to a change in policy or a specific limitation on telehealth services. Differences in how a virtual visit is billed versus an in-person visit can also lead to surprises. Knowing these possibilities helps you approach the situation with more clarity. To effectively navigate this process, begin by thoroughly gathering all your documentation. This includes copies of the bill in question, your explanation of benefits from your insurance company, and any communication you have had with the provider or insurer regarding the visit. Next, contact the healthcare provider's billing department directly. Explain your concerns clearly and calmly, providing them with the specifics of the bill and why you believe it is incorrect. Be sure to note the date, time, and name of the person you spoke with during this conversation. If your initial conversation with the billing department does not resolve the issue, politely request to speak with a supervisor or manager within that department. They often have more authority and experience to investigate complex cases or make adjustments. If the provider's internal process does not yield a satisfactory resolution, your next step is to contact your health insurance company. Explain the situation to them, highlighting that you have already attempted to resolve it with the provider, and ask them to review the claim. Your insurer can often mediate or provide further guidance on appeals processes. As an important insider detail, always keep a meticulous record of every interaction, including dates, names, reference numbers, and a brief summary of the conversation. This detailed log is your most valuable asset throughout the escalation process. Additionally, be aware that many insurance plans offer an internal appeals process if a claim is denied or partially paid. Understanding and utilizing this formal appeal can be crucial for a favorable outcome. In some persistent cases, you might also consider reaching out to your state's Department of Insurance or Consumer Protection Agency, who can offer additional guidance or intervention. By methodically following these steps, documenting every detail, and advocating politely but firmly for yourself, you significantly increase your chances of successfully resolving a virtual care billing dispute. This proactive approach not only helps you avoid paying incorrect charges but also provides peace of mind, ensuring you can confidently utilize virtual care services without unexpected financial burdens.